Should your baby be nursing on both breasts each feeding? Why or why not? Let's go.
Be confident and successful in your breastfeeding journey.
Now, we usually want baby to nurse on both breasts each feeding. Now, this is for babies from birth to about 6 months old. An older baby is usually better at transferring milk, and they can get what they need from one breast each feeding. So they can start to go to that one breast each feeding. But for a younger baby, we want them on both sides, and it does a couple of things. It helps to establish your milk supply and increase your milk supply. So when baby's mouth is on and off your breast, that adds extra stimulation, telling your body to make more milk. So having baby on both breasts each feeding is really helpful. Now, the way that you do that is important. We don't want to put baby on one breast for, say, 10 minutes, take them off, and the other side for 10 minutes, because baby will get a lower amount of fat by doing it that way. The way you do want to do it is to put baby on one breast, have them stay as long as possible till they're falling asleep, coming off the breast, they seem content and full. Then you're going to switch into the other side. If baby's falling asleep, you can burp baby, wake them up a little bit, put them on that second side. Now, some babies just won't take the second side every time, and that's fine, but if they will, then try to latch them. Might just be a couple of sucks just for a few seconds, and that's totally fine too. Just having that little bit of stimulation really helps. Or some babies will latch and be on there again for quite a while. Now, the reason why you're going to keep them on one side as long as possible is because at first they're going to get the foremilk that comes out of your breast when they first start feeding, and that has slightly less fat in it. Then when baby's on longer, they start to get the milk from the back of your breast that's higher in fat, the hind milk. So we want baby to get that higher amount of fat before you switch them over to the second side. Now, for moms with a condition called forceful letdown and oversupply, those moms probably won't want to nurse on both breasts each feeding. In the beginning, in the first week or two, they still might want to help establish the milk supply. If you think you're a mom that has this condition, be sure to reach out for some help and have a video on forceful letdown and oversupply. I'll link right here. So you can check that out. But most moms have a little bit of a forceful letdown in the first couple of weeks. That's normal. Doesn't mean you have that condition. But if you think you do have the condition, you will have it with each baby. So it's good to understand it and to get some help with it. I hope that helps mommy so that you know if you should be nursing on both breasts each time. Let me know if you have a question. Ask below and I'll try to get back to you just as soon as possible. Thanks a lot, mommy. You got this.